Max Wardell, overheadathletics.com. We talked about hip impingement and how a lot of times athletes come in or patients come in and they think they have some sort of iliopsoas or psoas strain, and that's what they've been told by their trainer, by whoever, their coach, and they feel like, oh man, it really hurts, but it's the psoas, but it's really when I sit down in a chair, or maybe it's when I do some sort of range of motion rotation activity. And we talked about how you can look at whether it's actually the psoas or whether it's actually the hip itself. So maybe the hip is impinging. And so that was a topic that we talked about briefly before. And I've actually had some hip issues in the past. I've had hip surgery, and so I've kind of been there myself. And what I'd like to talk about is hip rotation. How do we improve it? So we have external and internal rotation. This is external rotation, where the femur bone rotates towards the outside. Internal rotation, the femur rotates towards the inside, the foot goes out. And it's very limited when you get up here in flexion. And I'm somebody that's naturally tight. I've had a hip that I had 0 degrees of internal rotation before I had surgery. So I've had to accumulate time in various stretches to recover range of motion. I have a cam lesion here, and I have hip impingement. That doesn't mean I can't acquire range of motion. So if you're somebody out there who has some amount of hip impingement, the most important thing you can do is stay in a pain-free range. So when I'm actually sitting, and I'm gonna put my leg up on a table. We got a PT table here. You might put it up on your counter at home. You're gonna find, where do I feel restriction? And it's not that pinching. I got to be able to differentiate between a muscle pulling and pinching inside the joint. And I'm going to say, okay, I found, oh, right there, I feel something. Now I can go. I'm going to rotate this way, which will hit maybe some more different fibers of the TFL, maybe some of that hip capsule. I can turn into it and try to rotate my pelvis this way into the hip. Oh man, now I can actually hit some of those external rotators of the hip that are now internal rotators when I get up here. And now I can feel it in my back butt here. And maybe that's where I'm most limited. Keep my chest up tall, rotate into it. Maybe I need to come out this way, and this is a stretch. You've seen Kelly Starrett do this sort of thing. So these are some ways we can start to work on that range of motion. Now, if I have somebody with impingement, which is what we're going to talk about here, it's like, how can we get this hip to improve in range of motion without impinging it? Well, one easy way to do that is find a range of motion where it does impinge, but I can still feel a muscular stretch. And I don't have to go super far into it. And if I'm like, okay, I can feel a stretch, but I feel a slight pinch, take my hand, I can push right down here. I'm pushing down and out. Does that relieve it? If that does, then I'll keep pushing there. If it doesn't, I can come in more on the inside and push more laterally. I'll find a position where I can push into that joint a little bit and try to actually increase the range. Now, if I want to work more on external rotation, I can come back here, do this sort of thing. If I need to, give it some inferior lateral traction, so I'm pushing with this hand through the joint if I need it. And really, I can go up tall, forward. I hunt for those tight spots, but I really hunt for where I can find a stretch without impingement. And so it's more indicative on my left leg here. And you'll notice, oh, that leg's a lot tighter. Uh-oh, he can't get it to the ground, or he can't get it to the table. And right here, I can feel a tremendous stretch on the outside of my hip. And I'm not feeling it on the front of the hip, and I'm not feeling it deep in the hip joint itself. And I might have to grab here, rotate into it. Now I'm really stretching that back butt. So this is external rotation. That's great. What about internal rotation? We want to improve it in flexion. We got to be very careful with internal rotation because that's more likely to impinge it than even external rotation. So once I've kind of hung out here, opened up my hips, as a lot of people say, now I'm going to go into internal rotation. And one of the best ways to do internal rotation, we kind of have a couple options here, is I can come up here, like I'm going to do an external rotation push here, but now this leg actually brings me down into internal rotation here. But here's the problem. You see that my knee drops inside a 90 degree, or inside a midline. And a lot of times that's where people get impingement. So what do? I tilt my body this way. And now my leg is still in that open chain. I can feel a stretch around the joint itself, but no pinching in any one spot or no pressure in any one spot. And I can feel kind of this longitudinal stretch around, and that's my hip capsule. So we have this capsule, this fibrous tissue, surrounds the joint, kind of like saran wrap. And I'm stretching that out here. So here's our hip capsule. Bring it in here. Here's our hip capsule. When you stretch in flexion, you can see that I'm stretching part of that capsule out. When I stretch into extension here, I'm stretching once again part of that capsule out on the front side. And if I go into abduction, I also stretch out the underside. But here's what happens. When I rotate, look at how it winds up that capsule. When I rotate, winds up that capsule. And when I have somebody that's mechanically impinging in the front of the hip, a lot of times if we can actually acquire some mobility in the back of the socket, it won't push the joint so far forward. So a lot of times what happens is I'm tight here, this is restricted in the back or in the front or wherever, and that causes the joint to not articulate properly in the socket. And now all of a sudden the joint is impinging on the front of itself, whereas if we had some more stretch in the back like this, the joint would sit properly in the socket. And so I hope that's something that you can visualize. I know it's not easy here on video, but I want you to be able to see that this is something what the capsule is like. And I always tell people it's kind of like saran wrap surrounding the joint. So now we've got a way to improve internal rotation. But now what about internal rotation as we get up into flexion? And an easy way to improve that is I'm on a bench, I'm on something like that, and I can bring my knee up here onto the edge of it. I'm up into flexion. I'm going to open my hips up. So now my knee is not across my body. I'm going to apply a little sustained stretch. If I feel a pinching, I need to readjust. Do a little short lever, short this way, lever rotation. Or I may stick down here in this range where I can hit the joint without impingement. Now, maybe you're at your physiologic limit or your anatomic limit of flexibility. I don't have any more. It impinges no matter where I put it. Well, hey, what we got to do is we got to acquire as much as we can in the opposite direction, and we got to teach you how to move in the best possible way, ensure that you have the best possible rotation through your knee, through the tibia, those sorts of things to get you to move much more efficient. I have somebody right now, baseball player, has virtually no hip internal rotation. There's not a lot we can do. But if you're not getting impingement symptoms, when you go into these various stretches, there's something you should do. If I'm getting impingement, the front, back, side, anywhere deep inside or a pinching in the front, that should tell you right now this isn't a good stretch for you. Find a position where you can do these stretches. You can hit different ranges of motion. If you're still having impingement problems or it's very acute, it may be, like we said in the last video, something you need to get checked out by your physician. But give these stretches a try. This nice wound up one in flexion here. A little more external rotation and abduction and flexion there. And then give the internal rotation one a try. The last thing you can do for internal rotation, I almost forgot, is what we call the sleeper. So I'm laying here. This is a great one in flexion. I'm laying here and I'm just letting this ankle fall to the ground. The other thing I can do is hike this hip up a little bit by bringing my knee up. Now I'm just letting my leg sink. This is a hip with cam deformity, which is a deformity of the femoral head, and I can sit in this position absolutely no problem. Acquire a few degrees. I might have to hang out in that stretch for 5-6 minutes. Very low intensity stretch, but there's some different options that you have to improve hip rotation. So make sure to like, subscribe, and come back for our next video, because we're going to come at you with more videos like this if this is the type of content you guys like.